Hi, everyone. It's Melissa Cameron from Acclaim Health, and welcome to the live COVID-19 update. We are going to get started. I just wanted to let you know that everybody is muted right now so that we can control the sound quality. We do want to take your questions, so if you could just type those into the chat box, we will be taking those at the end of the presentation. Thank you so much for being with us here today. The last 2 months have been crazy. I think we'd all agree. For over 2 months now, we've been dealing with the pandemic here at Acclaim Health, and it's had a huge impact on our organization, as you can imagine, and of course, a huge impact on the many families that we care for and that we help. Today, you're going to hear from 3 of the leaders at Acclaim Health who have been instrumental in leading our COVID-19 response, including Angela Brewer, our CEO. So as I mentioned, we will be leaving time to take your questions. I know people have probably a lot of questions about the COVID-19 pandemic. So if you can enter those into the chat function, that would be great. We will be monitoring those and getting to them, as many of them as we can. So right now, I would like to introduce Angela. Angela is going to give you an update on everything that's happened in the last 2 months. Angela?
Well, that is a tall order. Thank you very much for that introduction. First of all, I'd like to thank everybody for joining us today, and to Melissa for that great introduction. Thank you. As she said, this has been 2 months, so 7 weeks, almost exactly, since the pandemic was declared. And for anyone who's been watching, and I'm sure you all have, it's been an ever-changing landscape. As we learn more about the disease, as more data is presented, and sort of as it traveled across the world. So I was watching very carefully, definitely when it was in China, but as it moved through Europe, I think that's when we first started to see some of the images that were pretty frightening about what was happening there. And so that's when we sort of really looked at our pandemic plan and started to dust it off and get it ready, because it certainly looked like it was going to become global at some point. So, and then on March 11th, the actual pandemic was declared, and it's been 7 weeks since then. As I said, it really has been, I mean, I can't think of a better word for this than novel. It has been a completely new experience, I think, for everybody. All the way from social isolation to working at home with your kids around, or your barking dog, or all kinds of things, to people who aren't working anymore and people who have to worry about their businesses right now. So there's been a lot of impact, not only on people's health, but also on economics. So as I was saying, I did watch it progress through Italy, and as a former ICU nurse, I saw some pretty terrifying images coming out of Italy. The exhaustion of healthcare resources and those things. So that was quite worrying when it started to hit North America. I have to say, this is my personal opinion, that I think our government has done quite a good job, given what they knew at the time they made each decision, in really reducing the spread here. So we haven't seen the type of situation that they saw in Italy or Spain or Germany, or even in our next door neighbors, the US, especially in some of their hotspots like New York. So we haven't seen any of those really horrible situations. We certainly have seen some hotspots, particularly in long-term care, which is pretty heartbreaking when you think about how vulnerable those people are. So part of our response was to really make sure that our staff and our clients were safe, and especially those who were most vulnerable. So we've done a lot of things around that. Some of it was preparation, so making sure that we had all the PPE that was required, which is a huge feat in and of itself. We'll talk about that in a bit. Making sure that we communicated with people. So really communicating with our patients, with our staff, to try to reduce as much fear as possible, and to help people understand how they could be prepared for the pandemic and how they could keep themselves safe during the pandemic. We are now caring for people who have COVID-19, and we do have some staff who have COVID-19 as well. We're keeping a very close eye on those people. Our staff are prepared with all the safety equipment that is necessary to go in and take care of people with COVID. We've definitely run into some challenges as this has progressed. We have had quite an impact on our staffing for a variety of reasons. Some people had childcare issues because the schools are closed. Other people had been traveling, because I think everyone remembers that was right around March break when this happened. And so they were in self-isolation for a while. We do have some staff members in a high-risk category who just can't work right now because it's too much of a risk to their health. And we have a lot of people who were impacted by what they're calling a one employer rule. So if you work in long-term care, you've probably heard this on the news, it was pretty customary for people working in long-term care, especially personal support workers, to have 2 or 3 jobs. And sometimes we were their first job and they were working in a retirement home, or long-term care as a secondary job, or sometimes long-term care was their first job. So when they were presented with this choice they had to make, they often, as would make sense, chose the employer where they were doing the most hours. And so for some of our staff, that wasn't us, that was long-term care or it was a retirement home. So all in all, it has really had an impact on our staff. And I would say, I'm going to try to remember the numbers right now. I think we have a 21% absenteeism rate related to COVID for our nursing program, and it's 38% for our PSW program. So those are some pretty significant hits. I have to say that the staff who are remaining have really stepped up to the plate. They're taking more hours. We've had to move people around so that they're either working in the community or in a retirement home, but not both. People have been amazing. I mean, I could go into a lot of stories, but I will just say that people have been nothing short of amazing in really responding to this. We have had a lot of fear from our patients, especially at the outset where there was a lot of unknowns, that our staff would bring COVID to their homes. I don't think they understood that we were prepared with PPE and that our staff were quite well trained in infection prevention and control. And so we did have a number of client cancellations to start. Some of that fear seems to be wearing off, I guess is the best term for it, as this becomes more of a new sort of normal right now. Not that it'll be the normal forever, but it certainly is the normal right now. We also saw PSWs especially are not high wage earners, and we saw them struggling to work in a system that didn't really value them and didn't really recognize the high risk situations that they were being asked to go into now. I'm really pleased to say that we were able to do quite a lot of advocacy with our provincial associations and other providers. And I'm sure everyone heard Doug Ford announce the other day that he is giving a $4 an hour wage increase to our PSWs and nurses across the healthcare system, as well as a number of other providers who have really stepped in into this pandemic in a big way. So we're really, really pleased with that. I think the thing that strikes me the most is how ever changing the situation is. And when I say ever changing, there were weeks there where we were getting new directives twice a day, sometimes on an hourly basis. This was all weekend, any hour of the day, and we had to be really nimble and able to address that. And again, I think our staff really stepped up to that. One of the other issues that we've had is, and I'm sure you've heard this on the news as well, a shortage of personal protective equipment. So obviously that is key in being able to serve people with COVID-19, and also key in preventing other people from getting it. So we have at one point had 3 people working full-time on trying to source PPE, so from some very non-traditional sources, let me say. And so we have spent, in the last month, I think we've spent about $60,000 on PPE. Our normal spend, just so you have some sense of comparison, is about $7,500. And that's not only volume, that is cost. So the cost of PPE has really, really escalated. I know there's anti-gouging legislation out there, but because of supply and demand, it is a huge increase in cost. So an example I can give you quickly is one of the isolation gowns used to be about 50 cents a gown. You can get them anywhere from $8 a gown to $13 a gown now. So a big increase. And it has been hard to source, as I said. So we have had to use sources that we wouldn't normally use. I think we used a tattoo shop supply place to get some gloves, which were just as good as the gloves we normally get, except they're way cooler and they're black. So some of our PSWs really like that factor about them. So I do want to stop and thank everybody for really helping us with our pandemic fund. So a lot of people contributed to that appeal that we did, including the Oakville Community Foundation and Burlington Community Foundation. And that's really helped us be able to source the PPE that is, as I said, at a much higher cost. There is a story that I just want to share before I stop talking. And this is particular to one retirement home that was in an outbreak situation with COVID. So it's not a retirement home we normally serve, but we are the palliative care provider for Halton. So when this home went into outbreak and they had 80 of their residents test positive, 30 of them were symptomatic. Some of those people became palliative. And so we were given those people to care for. And it was sort of our first foray into a congregate setting where we had multiple COVID positive patients. So rightly so, a great deal of anxiety on the part of our staff. But we had one PSW, her name is Sherry, who actually said that she went for a long walk with her husband one night because she really wanted to work in this home and wanted to make sure that he was okay with it because they also have 2 grown children living at home with them. And between the 2 of them, they decided that that was something that they could support her doing. And she actually said to us, I don't want to do some of it, I want to do all of it because I want to ensure that not all of the PSWs in my area are put at risk. So really, I mean, if that's not above and beyond, I don't know what is. So she had been going in there. She actually has a trailer at her home and she has been living in this trailer. So her husband and her children live in the home. She lives in the trailer. She goes into the retirement home. She cares for those people with COVID. She takes a shower after she's done, and then she comes home and self-isolates in a trailer. So I can't think of a better example of somebody really giving to this cause. The interesting thing about this is that of the 30 people who were symptomatic and the 15 or so that were palliative, it looks very much like a good majority of those people are actually going to survive this. So that is a real kudos to that particular retirement home and our staff that's going in there to support them. There was, in fact, a woman there who is 101 years old who got the novel coronavirus and has recovered from it. So that is a pretty astonishing story for somebody that elderly and vulnerable. So I'm going to stop talking now so somebody else can talk. Thank you for your time, and I'll put it back to Melissa now.
Thanks so much, Angela. I think that gave everybody a very good idea of what we've been dealing with for the last few weeks. And now I'd like to introduce Renita Wood. She's our Director of Adult Day and Caregiver Support. And she is going to tell us a little bit about the experience of families who are caring for someone with dementia through this time. So Renita, over to you.
Great. Hi, everyone. Thank you for joining us this afternoon. We quickly had to learn to adapt to providing face-to-face service to now providing service through the phone, through Skype, Zoom, FaceTime, whatever modality worked with our families. And the staff quickly were able to turn on the dime and provide this excellent care. They commented, and the families have commented to us now that they're now having richer, deeper conversations than they've had in the past. That those conversations, which may have started in those first few weeks as 5 to 10 minutes, are now 45, 50 minutes, an hour on the phone with either the client or the caregiver, and just talking about life and experiences. And they're really developing stronger, richer relationships with all of our families. Caregivers are accessing now the virtual online support groups that are there for them, as well as joining social groups, just having a time where they can join together on Zoom or Skype or through the phone, and just socializing together and having some fun to reduce some of that social isolation. Our families are mentioning that they're learning to develop some routines at the home. So after breakfast in the morning, they'll get up and they'll put on one of the exercise videos that's on our YouTube page. They will then pull out the activity books that have been dropped off on their porches and work through some of the activities. The caregivers have said they're enjoying the activities as well with the clients, and it gives them a chance for them to share these moments together. Some of our staff have linked some of the clients that were friends at the club together and spoke their native language together. They linked those clients together so that they can still maintain that the bond with each other. So some wonderful stories that are coming from our caregivers on these relationships that are developing and the time that they have together. Now, we're also mindful that this is moments in time that are being developed with the homes, that the caregivers are still providing the full respite care for 24 hours, 7 days a week. That some of the concerns has been that there may be some increased restlessness at home, some increased behaviors that they're concerned about, where we're able to link them to the BSO resources. So Behavior Supports Ontario is still providing services, although virtually. So some of that concern is coming from our families on the ability to provide that respite care. One of our thoughts as we get closer to thinking about opening is that our clients will change as they come to us back onto service. That there may be some deconditioning that's happened just because maybe they're sleeping longer, not moving around the house as much, not used to the routine of the day program. So that will be a consideration for us as we start when we're able to open the day program, that our clients coming in may be slightly have different needs than they had originally. And that is a big question that everybody has, is when we're going to open the day programs. But unfortunately, until we get some direction, we'll look for the province for the directions. We'll look to public health for directions. And I do meet weekly with the other ADS providers in the region as to what the plan is when we are ready to open. So I look forward to your questions, and thank you, and I'll turn it back to Melissa.
Thanks so much, Renita. I know it is really tough for all those caregivers out there who are caring for people with dementia during this time. And I know our team is doing as much as they can to support them, which is wonderful. But I know everybody really wants the day programs to open as soon as possible too, when it's safe, of course. I'm now going to introduce Patricia Blakeley. She's our Director of Community Support Services. And she's going to be talking about some of the ways we're tackling the issue of social isolation during the pandemic.
Great, thank you very much, Melissa. Yeah, so I have to start out really just by saying something that we've always known all the way along, but has become even clearer during the pandemic, and that's just simply that our volunteers are the best. They are fantastic and devoted and committed, and we just can't say enough about them. When we put our volunteer visits on hold at the beginning of the pandemic, we found even as we started to follow up with the volunteers to chat with them about it, they had already been in contact with their clients, told them about the situation, reassured them, said they're not going anywhere, and many of them set up calls for multiple times a week. So they really recognized right from the beginning that their clients would need additional support during this time, that the risk for social isolation would increase. And that's across all of our programs: hospice, bereavement, friendly visiting, memory visiting, even our home support exercise program. And the feedback from our client really has overall been very, very positive. Of course, they'd rather that their volunteer was visiting in person. That's what they know, that's their routine. But they're enjoying the calls, they're finding creative ways to visit over the phone, and there's a lot of comfort in hearing from that regular familiar person that they're used to seeing on a weekly basis. So it's been going, the virtual visits and sort of moving to telephone support has gone very, very smoothly. The other thing that we've learned, though, really is the importance of all of our community partners in this as well. We've been very fortunate to work with Heart House Hospice and Dorothy Lay Hospice to establish a helpline to provide emotional support for staff at long-term care and retirement homes, as well as their residents who are palliative and their families. So we've already spoken about the challenges that long-term care and retirement homes have faced. And so as hospices, we really wanted to be there to provide that emotional support, and particularly for those who have had losses, to support them through bereavement as well. We've also been fortunate to be able to offer that same type of emotional support to our staff, because it's really important that we take care of our own people and that all staff feel that they are supported through this. But there are things that worry us. We know that many of our clients across all of our programs are isolated. Many have little or no family support, or if they have family, they're not nearby. And because we're no longer going into our clients' homes, we aren't really eyes on them in the same way that we normally would be. So just to give you an example, we have a friendly visiting client. She's 95 years old. She doesn't have any children. She lives on her own. She is fiercely independent, but she's also showing early signs of dementia. So her volunteer has been visiting her for years. Every week they go grocery shopping, come back to her apartment, they have a visit. So the change in the routine, having her volunteer pick up her groceries and drop them off instead of actually going out, has actually been it's been disorienting and disconcerting for her. And she's showing sort of greater signs of confusion. And when the volunteer dropped off the groceries, she's noticing that her client is asking for fewer groceries each week. And the last time she dropped them off, she could see from a safe 2-meter distance that her client is losing weight. So we already are putting in plans about what we can do to support her, how we can ensure that she's eating properly. We're in contact with her nephew, who is fantastic, but he lives far away and can't come and see her. And it's worrying because we just can't provide the same type of support we would have in just kind of more ordinary situations. So this is just one example, and we have clients that we are worried about, and worried about the impact of the ongoing isolation and loneliness. But there's been lots of inspiration and lots of good news stories through this as well. And when I think about that, I'm not thinking about kind of really the big things, but sort of the small, generous gestures that are ongoing all the time. And I have to say, our staff has been incredible through this, incredibly supportive of their volunteers, of their clients, and of the organization as a whole. And the volunteers, as I've already said, have just really stepped up to provide support to their clients. So a couple of examples. One of our memory visiting care managers, she has been writing handwritten notes to all of her clients. For many of them, the telephone can be confusing because they have memory impairment, but everybody loves to get mail. And what's just as sort of an extra step for those clients that speak a different language, she's been using Google Translate to write a note for them in their own tongue. And that's been incredibly appreciated. They've also had a lot of laughs because I don't know if you've ever used Google Translate, but it isn't always 100% accurate, but it's been cause for lots of fun. Another example is a volunteer who was concerned about her client because her client is a really avid reader, and it's a big part of her daily life is to read books. But when the library closed, she wasn't having her weekly delivery of books. So the volunteer went to a used bookstore and carefully selected titles that she thought that her client would enjoy. And then she doesn't actually live close to her client any longer. She moved a couple of years ago. And so she decided that she should mail the package. But the day she went to the post office, she started to have a sore throat. She started to feel not so well. So she took that extra step. She called her client and made her client promise that she would quarantine the books for at least 3 or 4 days to ensure they'd be safe and virus-free by the time she opened them. So those are just a couple of stories of the different things that we're doing to support our clients. And it just humbles me to see just the many ways that our volunteers and staff are supporting their clients during this difficult time and also bringing joy to them. Which is really helping with the social isolation and just ensuring that they're okay. So yeah, so thank you very much. And again, I look forward to your questions as well.
Thanks so much, Patricia. That was great. And I hope for those of you listening on the call, I think one of the reasons that personally I'm very proud to work for Acclaim Health is just the depth of caring that everybody involved with the organization has. Our staff certainly, but also our volunteers and even all the clients and patients and families that we care for. I think everybody cares an awful lot about others, and that's what makes the organization sing. Certainly the last 2 months have presented new challenges. Every day has brought some heartbreak of some kind to us. And as Angela said, we've all been working like crazy, like totally bonkers crazy. But I think the one thing that has kept us all going is certainly the extraordinary, outstanding, and amazing support of all of you. The community has been behind us 100%. And we would like to thank you so very much for that, because you have no idea just how much it means when we get an email or a quick note or a kind word or anything, just to let us know that you're thinking of us and behind us. And we have been passing those messages on to our staff in their PPE care packages so that they can see them as well. So please keep that coming, because it has been helping more than you know. Yeah, I guess so. Just thank you from the bottom of our hearts. We are now going to transition into the question and answer period. So I'm going to ask Angela and Renita and Patricia to put their video and their microphones back on. And Laura Pizzacala has been monitoring the chat, and she is going to let us know what your questions have been. So over to you, Laura.
Thank you. Okay, our first question here is, how are your PSWs managing? We hope they are keeping healthy and safe. So Angela, I'll throw it to you to answer that. Absolutely.
Our PSWs, I would say, I can't say enough about them. They're champions for sure. They have, as I said before, really stepped up, especially considering that we have a number of people who aren't able to work right now. We're supporting them in a number of ways. So we have frequently asked question application. Everybody's got a smartphone, so they are able to submit questions into that. Those get answered every day so that people can express their worries, express their fears, their needs, and they'll get an answer within 24 hours to those questions. We also have a supervisor who is basically on call 24 hours, 7 days a week to answer any COVID related questions. So questions like, my client is sneezing, does that mean that they need to self-isolate? Those kinds of questions. Or here's what happens, what should I do about it? And so our infection prevention and control liaison, who's also one of our supervisors, has been available to answer those questions. We also have a hotline for clients around the same sort of questions that is answered on a daily basis. I think the best support that we can give our staff is to keep them healthy and safe. So to that end, really ensuring that they are provided with a proper PPE, and sometimes even with more PPE than is recommended at any given time. So a few weeks ago, masks were not being recommended. We decided to go ahead and have our staff wear masks just as an extra safety precaution. And a couple of weeks later, they did actually come out with that same recommendation. So we were really happy that we did that. And we have had, let me just circle back to our, we call it our COVID FAQ application on the phones. We have had, I think, a question every single day since we launched it, at least one question, usually multiple questions, except for one day. So I think it was a great brainchild. It was probably one of Melissa's ideas. It sounds like one of hers, to come up with that and really helped us communicate with our staff. I think the other big thing we did was advocate for that pay raise. So really acknowledging that it is a riskier situation than they normally work in, and acknowledging that by advocating for a pay raise, which we were successful in getting. So we're really pleased to announce that. I think that was the best thing that happened in the last 7 weeks, actually.
Great. Another question about PSWs, Angela. Will the segregation of PSWs that work at retirement homes and private homes continue?
That's a great question. So, and I mean, the basic answer is I don't know. And I think there's a lot of I don't knows right now, but that's one of them. I would suspect it's going to continue as long as there is no vaccine against COVID, because it does help to reduce the transmission by limiting the amount of transactions that our staff have with other people. So I would say in the short term and possibly in the next couple of years that the answer to that will be yes. After that, it really depends on what the new normal looks like, because we were always, I mean, our commitment is to keep our staff and our clients as safe as we possibly can and to reduce the risk. So we're going to do whatever that takes.
Okay, great. And another one for you, Angela. How is your palliative care team managing patients dying at home right now? Are they able to have close family members with them to provide comfort? And how are the palliative team members managing their energy and caring with the risk of COVID on top of the palliative needs?
It's a great question. So for those of you who don't know, we do have a dedicated team of palliative care nurses and palliative care PSWs because we are the sole home care provider of palliative care in Halton. A wonderful team of people, extremely dedicated to their profession and to their specialty. I would say that they continue to be just as dedicated. What we have seen though are some patients coming to us who are palliative with COVID. So a little bit different than what we would normally see. Our staff, I would say, took that in stride. There's obviously wearing the correct protective equipment, but their energy is going into caring for their patients as always. That is their passion and that is what they do. And they're basically not going to let this coronavirus stop them from doing that. In terms of supporting them, they meet weekly and we support them that way. We also have, for all of our staff, the ability for them to connect with our employee assistance program and get free counseling, because this obviously is an extremely stressful time for people. And we have some of our counselors in our hospice program available to staff right now, recognizing that many people have been impacted with a death of a relative, and that people are dealing with their normal level of work stress in addition to being in a bit of a riskier situation than they normally are. So those supports are available to them. And the other part of the question, family members, because it is in a home setting, it's different than hospital, so they are allowed visitors. It actually is probably a nicer place to die right now because you can have your loved ones with you. Some hospitals, or most hospitals, I think, are allowing one visitor. Some hospices are allowing one visitor, but at home, we don't put the same type of restrictions on. What we ensure is that people are safe while they're doing that. So, which might include social distancing and hand washing and all those other things you've heard of a million times now.
Okay, Angela, another question for you. We've got a couple for you. Matt, I have a question about masks, using them both ways. So with our staff and clients, is there value there, and is there availability of it?
So the best practice for mask use is just the provider. So the real risk is that the provider may be a carrier. The client could be a carrier as well. But as long as the provider is wearing a mask, then the provider is protecting themselves, but also protecting the people in the home from getting coronavirus should they have it. If someone is COVID positive, best practice is for the client to wear a mask as well. I'm sure many of you have heard that shortness of breath is one of the symptoms of COVID, and so we would recommend a patient wear a mask unless it is not comfortable for them to do so. So if they're quite short of breath, wearing a mask is going to be quite claustrophobic for them and will make them feel more breathless. So we wouldn't recommend it in that situation.
Okay, thank you. Now, question for Renita. Renita, I know you touched on a little bit about when the day programs might open, but what physical distancing plans do you have in place for the day programs?
Great question. And I have to say that's actually, we haven't come that far in the plan yet. But that is a consideration as to how we're going to phase open these day programs, whether it's going to be a limited number of people per day, whether our staff will have to use the PPE equipment as well. Those are all questions that will be in discussion with all the other ADS providers so that we each approach it in the same manner.
Okay, great. Angela, another question for you. Has the cancellation and postponement of important medical treatments in the hospitals been a concern for Acclaim Health?
That's a really interesting question. We were having a discussion about this yesterday. So we have seen a decrease in the normal number of referrals that we get from the LHIN. And I talked about this with our director of that program, and we, after a few minutes, realized that that would make good sense. The hospitals are not doing elective surgery. I think probably most people have seen pictures of empty emergency rooms as people are not seeking treatment for fear of contracting COVID. So those things are trickling into home care a little bit, in that if people aren't accessing that service, then they're not being recommended for home care. Same with family physicians. They're not seeing people in the same way they normally would, and people may not even know that family physicians are accessible right now virtually. So we are seeing a little bit of less referrals, although I would say that the sickest people are still getting the care that they need. Did I answer that whole question, Laura?
I think so, yeah. And this is another kind of difficult question. But Angela, do you have a sense of when people might be going back to work with COVID-19?
I would say that your guess is as good as mine. I think that we're starting to see some good data in the fact that the new number of daily cases in Ontario has been dropping pretty steadily over the last week. So I think that we are definitely looking at being at a plateau. I am quite pleased with what I hear from the Ontario government in their tiered plan. I know there's other provinces that are planning on opening schools this year, and I would definitely have some concerns about that. And I know that's a big part of getting people back to work, but it's, to me, that would not be a #1 step to take. But I do think that we'll be looking at some of those businesses, probably like construction and things, coming online. I mean, I'm thinking maybe late May, early June, as long as the number of cases continue to decline, and that's a big if. So, and that's my best guess, and I don't really know that much about it, so don't take that to the bank.
Okay, thanks. That's all the questions that we've received.
Okay, thank you so much. Thank you, Angela, Patricia, and Renita, for sharing your thoughts and your stories and letting everybody know what's been happening on the front lines of our COVID-19 response. Thank you so much to everybody who joined us for this call. I hope that you found it interesting. I hope you found it helpful. We will be sending out a quick evaluation afterwards via email. So if you were on this call, please take a few moments and let us know what you thought. We may consider doing these every month or two as the pandemic, if and as the pandemic continues. So if you did find it helpful, please let us know. And thank you very much. Thank you to everyone. And thank you so much, most importantly, for your support. And we will talk to you later. Please stay safe and stay healthy.